Hi. I am doing a course on posture, and it's not specifically really all about posture. It's about what posture means, as in what a good posture is, but also what is poor posture, because most of us know that we have poor posture or that our posture could be better, but we don't know what we can do about it, and we don't understand what we can do about it. So speaking to lots of people and asking some people some questions, I've been asking, what's your posture like? What do you think of your own posture? What don't you like about your posture? What do you think would be great to make it better? And most people have said, I don't know. I know it's bad, or I know it could be better, but I don't really know what good posture is, and no one really tells us what good posture is anymore. So that has been a bit of an eye-opener, because as a physio, I know what good posture is. I know that if I'm sat chatting to you, I'm going to be in my best posture. But I know if you look at me at front desk and I don't think anyone's looking, I'm going to be here, because it's not easy for me to stay there when I'm standing to attention and I'm trying to teach and I'm trying to manage people. I need to look like I know what I'm talking about, where in actual fact I spend most of my day in that type of position treating people. So, poor posture and good posture are all relative. There's a big move in the general world online at the moment to say that, certainly in our physio world in Australia, there's definitely a bit of a movement to think, is good posture and poor posture such a big deal? As long as we're moving, is it a big deal that we have the ideal posture? And I beg to differ. I think it's a huge deal. If you are in poor posture for a prolonged period of time, you are going to get pain. That's it, end of. There's no getting away from it. You will get pain, and you will have complications that lead on to pain. So if we're looking at pecs, if I'm standing nice and upright, my pecs are nice and open, my shoulders nice and open. If I have poor posture, my pecs get tight. Now, if my pecs get tight, it pulls my neck forward as well. I get rounded shoulders. That means that I then can't lift my arm as easily because I don't have the range, which means that I'm liable to bursitis and impingement and tendonitis and other issues that surround the shoulder. If I'm here, I can get jaw pain because my neck muscles are short. Because I'm here, I can get headaches. So I get referred pain to my head. So I wholeheartedly think that, posture is a big issue. It's not a sexy subject. It's not one of those great subjects where people think, yay, I'm going to work on my posture. But it is important. And there is a whole host of knock-on effects that you can have. So just going with that first bit here, your pecs are tight, means your upper abs are tight because you're curled, means that the neck's tight, jaw's tight, and the knock-on effects that you will feel, because that's the important bit, is shoulder pain, tight ribs and tight pecs. You might not be able to get as much movement. You might struggle to reach into a cupboard. You might struggle doing up bra straps. You might struggle reaching for your safety belt in the car or your seat belt in the car. You might find putting on a shirt is a bit awkward because you don't have that reach anymore. You might find doing hair or doing, zips up at the back are a little bit harder. Just basics that you don't think, oh, that's my posture. You'll think, oh, shoulder's a bit stiff. Oh, can't reach into that cupboard anymore. I can't spend a lot of time doing my hair because the shoulders get hurt. And that's what people notice. They don't notice an ouch pain. They notice things that they now can't do. Other things might be you struggle lying on your side. You might have been comfortable lying on your side, but you get up and your shoulder's a bit sore and your shoulder's a bit achy. And that's typical. You might find you could stretch and you could reach and you could lean back and it's just all a bit stiff and a bit tight. Or you might notice it's hard when you're reversing or trying to turn around in the car. And that's all indicative of having a posture that's slightly changed or having a posture that's slightly altered. So that's what we're looking at. And that was the point of our sort of course on posture. It's aimed at preventing all that from happening. It's aimed at giving you some ideas of what you can do. So if you're just starting to feel that you're sore, if you know that you're an entrepreneur and you spend a lot of time at the desk, or you're in that coffee shop lifestyle where you're trying to get out and about and meet people, or you're just a 9 to 5 office person that spends a lot of time static. The static posture means that certain muscles get tight because they're not getting stretched. Certain muscles become disused because they're not getting stretched and they're not getting worked, so we get weaker. And then we get changes in the joints because the joints get stiff, and that all leads to pain, which can then lead to things like shoulder impingement, headaches, occipital headaches, pain that comes in a band, or pain that goes over the back of the head. They're quite specific things that we're looking for and that we're asking. Tight pecs again mean that the shoulder muscles don't work efficiently, so that rotator cuff doesn't work as a cuff. Bits work sooner or a bit more strongly than others because other bits are tight, and we get caught and the tendon gets caught. We might get RSI, where we start to get repetitive strain, so carpal tunnel, tennis elbow, golfer's elbow, that type of thing, where these muscles get used a bit more because these muscles are a bit less efficient. That's the upper body, okay? Lower body tends to be a little bit different. We tend to be static a lot, so we load the lower back. So we might find that we have back pain or pelvic pain. We might find we get tightness through our hips. So because our knees are constantly 90 degrees and we're sat a lot of the time, we might find that we get hip flexor tightness, and that can lead to some hip pain as the hip joint doesn't move as well. We might get hamstring tightness, which can lead to pain because again, we're not using them. Our glutes get weaker. So the lower body tends to respond in a stiffness manner as well. We get muscles that work less, so they get tighter. They're not stretched as much, and that can lead to things like lower back pain, sacroiliac joint pain, pain in the tummy, pain in the upper abs. We can get pain at the front of the hips, pain that radiates down the front of the legs, and we can get things like bursitis, where we get sore when we're lying on our hips at night, and that tends to have that knock-on effect lower down. So there's definitely a whole heap of things that, while not directly caused by poor posture, they're indirectly a result of it. So because pecs get tight, we could have a shoulder impingement. So there's no point treating the shoulder impingement unless, we treat this bit as well. If we've got tight hip flexors, there's no point releasing the tight hip flexors if they're working because they're tight, and we've got no glutes because our glutes have gone to sleep. So it's not a one size fits all. There's a whole heap of things. But if you think about things like hip bursitis, tight hip flexors, shoulder impingements, carpal tunnel, headaches, occipital headaches, neck pain, shoulder pain, tight chest, little bit of trouble breathing, that can also lead on to bloated tummy because our hip flexors are stiff, or our hip flexors are tight and they're overworking or short. And then obviously we can get some digestive issues just from being lack of movement. So the aim for the course was really to give you guys as much information as you can have to try and prevent all that from happening. And if you have had, a problem with your shoulder or a problem with your hips that you want help with, but you haven't got time to go and see anyone, or you just want to do it at home, or you think, I can cope with this myself, and if I can't and it's not working, then I'll need to get some help. This is aimed at you. It's aimed at those who know they need to do something, but they either can't get to somebody to help, or you want to try and sort it out first yourself because it's not quite bad enough. And you just want some tips and some strategies, and you want better posture because, let's face it, who doesn't want good posture? It's not a great subject to talk about. When I've talked to people about posture, they're like, yeah, I know I need to be better, but I don't know what I need to do. So we're going to tell you what you need to do. We are going to cover what is shoulder problems, what are shoulder impingements, what does it look like, how do we fix it, how do we prevent it, what is occipital tightness, what does that mean, how does it give you headaches, what can you do to stop it, what is scalenes, where are those muscles that pull in, what is rib tightness, pec tightness. So we actually tell you this is what it is, this is why it causes pain, this is where you will get pain. This is how to stop it happening. Same with the hip flexors. These are your hip flexors. This is where the pain pattern for hip flexors goes. If you sit all day, you are going to get tight hip flexors. Don't care what people say, you will get tight hip flexors, unless you're an athlete and you go and you stretch them every day. Most of us aren't. And you'll get tight hip flexors. This is where the pain pattern is for tight hip flexors. This is what your hamstring length is, how to test your hamstring length. Is it tight? Is it weak? Is it normal? And then how to fix that. And we'll also go through some sort of pelvic positioning. Where is poor posture as opposed to good posture? What are we looking for? How do you know? So there'll just be some specific tests that you can do yourself. There'll be a lot of video format that you can follow along with. If you have acute shoulder pain that is agony and you can't move your arm and you can't do this, is this course for you? Not for shoulder treatment, no, but it is for you in terms of everything else that goes around shoulder treatment. So it's not a management plan for your acute shoulder problem. You need to get that looked at, but it is a management plan for everything else around that could lead to that shoulder problem and how to stay better once your shoulder problem is fixed. So yes, it is for you, not directly for your shoulder acute impingement or bursitis that actually might need official hands-on management. Will it help back pain? Yes, because we're teaching you what you can and can't do to alleviate pressure. Will it help hip pain? Yes, because same thing, we're telling you what it's caused by. If it's an acute disc, an acute back, an acute hip, same as the shoulder, maybe not, but you'll learn heaps of strategies that will help you. And I'm very confident that it is a great course that you're going to find will help you in everything, because it will teach you what to do to help yourself. It will teach you what you need to be aware of that can cause problems, because most of us don't know. Most of us don't know what can cause problems. We don't know that if our pecs are tight, it means we can't move the shoulder, which means we get the shoulder bone hitting on that bone, which means we get the impingement. So they go away and get treatment, or they look up YouTube and they strap it and go, that feels better. And then it comes back 2 weeks later because they haven't fixed the mechanics of the shoulder. So for me to be able to move the shoulder here, I need the shoulder in a good line and my bone clears bone. For me to lift the shoulder here, it gets bone on bone and I get my impingement back, or I get my bursitis back. And that's the biggest thing that we're trying to do. We're trying to impart on you some knowledge that can help and can help long term. I started my business 10 years ago, and I started it because I was sick and tired of people not knowing what to do to stay better. I was sick of working for other people who basically didn't have the philosophy that I have, which is we should do everything in our power to educate you so that you know what to do to stay better. And that is what will help you stay better. And that's how we've built our business. We've built our business on the fact that people will refer to us because they know that we're not after week after week after week after week. We're giving you the information for you to stay better. I want you to know that if you have a tight pec, you know what to do to release it. You don't have to go to YouTube and look up 10 different things. You can go, that's from my pec, I stretch it this way, and you know what to do. I want you to know that your hip flexor refers pain this way, and if you're getting pain here, and the pain is in this pattern and it feels like this, that's hip flexor muscle trigger point pain, and you know what to do for that pain. You're not waiting 3 days to go, not sure, and you figgle around. You should have the knowledge that this is my pain here, feels like this, I do this. This is my pain here, it feels like this, so I do this. So you have a solution to everything that is an issue. If you know that you sit like this all day, you have a solution that you've got a back roll behind you, you have armrests to work on, you use pillows, you pad yourself up, you put your feet on things, you have something that you know is a solution for you. And that is my goal and my aim, is that you don't have to go through 10 different options before you find the one that fits you. You have problem A, I do X, Y, Z. Problem B, I do X, Y, Z. problem C, I do X, Y, Z, not problem A, which one of the 20 am I going to try? You've got something specific that you go to that works for you. So that's been the purpose of our posture course. And if you're interested, the link will be below the video, hopefully. And we start soon. It will be one that we run every 3 months or so. And at the moment, we start on this one on the 17th of June, I believe, is our start date. So that's next Monday. So if you're interested, you want to come on board, we are starting. I'm very excited because it's all online. And we've had lots and lots of inquiries, lots and lots of emails, and lots of questions from people, hence why I've done the video. Yes, you will get email. Yes, you will get some video advice. Yes, you will be able to ask questions. We have a Facebook group that we have set up. If you have a question, you can pop into the Facebook group and ask. Yes, there is an option for you to have me look at you. So if you want to take a front, a side, a back shot, and maybe some views of you walking and some pictures of you sitting, that way I can actually have a look and tell you what your posture is, what your posture pain is likely to be, and what things you should be working on to help you. So there is an option for a VIP for you to have that as well. Otherwise, it is purely via email and via videos, and if you have a question, you can email me direct. So posture course starts next week. I'm so excited about it, and I think it will be fabulous. And the aim is that you walk away from it after 6 weeks, because it will take 6 weeks, with the knowledge that you know what to do to help your upper body to be in a better posture. You know how to sit, what to sit, how long to sit for, what muscles are tight, what muscles you can stretch, what muscles generally need to be strengthened, and what your posture type is. Same with the hips, same with the bottom, same with the glutes, same with the hamstrings. You'll come away with effective ways to stretch them that will work for you. Some of them may involve getting on a mat. Most of them I've tried to make user-friendly. So if you want to do them in the office, you can. And hopefully that will help. So thanks for watching. It's been a bit of a blurb, 15, 17 minutes by the look of it. But it's all about your posture, and your posture is the only one you've got. So you need to look after your body. You need to look after your posture. And if you get better posture, you will be more pain-free. Take care.